Medicare Changes for 2025, helping you understand the difference between original Medicare with a... Hi, I'm Holly Cohen, a licensed independent broker and host of Preferred Medicare. We are a family-owned agency helping seniors across 50 states. In today's video, I'm going to explain the key Medicare changes for 2025 and also helping you understand the difference between original Medicare with a Medigap plan versus a Medicare Advantage plan. I've helped thousands of seniors over the years, and my goal is to make sure you have the knowledge that you need to make the right, most informed choice for yourself when it comes to Medicare. So let's start with the basics. Original Medicare consists of Part A, hospital coverage, and Part B, medical or outpatient coverage. While it offers comprehensive coverage, there are gaps, such as deductibles and the 20% coinsurance that you would have to pay if you're only on original Medicare. And this is where a Medigap plan comes in. Plans like G, F, and N gives you more predictable healthcare costs and the freedom to choose any doctor nationwide that will accept your red, white, and blue Medicare card. Original Medicare with a Plan G or Plan F or Plan N doesn't cover prescription drugs, so you will need a standalone separate Part D as in drug plan for that. And you'll want to make sure it covers your medications and at the right cost for you. If flexibility is important to you to see doctors across the country, original Medicare paired with a Medigap plan is the best choice for that option. On the other hand, Medicare Advantage is an all-in-one alternative to original or traditional Medicare. It bundles Part A, B, and usually Part D, as in drug, into a single plan, and they call that Part C. These plans often offer benefits like dental or vision or hearing. Some even have a $0 premium, but they do come with those network restrictions, a PPO or an HMO, and you'll need to use doctors and hospitals within that Advantage plan's PPO or HMO network, because out-of-pocket costs can be higher on Medicare Advantage when you need care. So the big question is, do you want flexibility, nationwide access with Medigap, or would you prefer an all-in-one plan with added benefits, but limited networks and high out-of-pocket costs through Medicare Advantage? The answer to that really depends on your own personal needs, your health, and your budget. CMS, or the Centers for Medicare and Medicaid Services, just announced that Medicare Advantage premiums are expected to drop for 2025, down to $17 a month. The national average was $18.23 a month, as reported from Fierce Healthcare. This reduction is partly due to increased competition among private insurance companies. But that's not all. About 60% of Medicare Advantage beneficiaries will have access to a $0 premium plan for next year. And 99% of those eligible for Medicare will have at least one Medicare Advantage option in their area. When it comes to Medicare Part D, premiums are also dropping. The average standalone Part D premium will go down in 2025. The new plan premiums will be announced October 1st. So make sure you stick close to this channel so that you understand as that information rolls out. So just to recap, the average standalone Part D premium this year has been $41.63. It's actually dropping to $40 for next year. So if you're enrolled in a Part D bundled inside a Medicare Advantage plan, your premiums are also set to drop on the average. This is great news, but you should still carefully review each plan's formulary, the list of drugs that is covered on your plan, because that can change from year to year. Again, if you're on a $0 monthly premium plan, many of those plans are still going to remain at $0. The exciting change for 2025 is the introduction of the $2,000 out-of-pocket cap on prescription drugs under Part D, thanks to the Inflation Reduction Act. This cap will help seniors and people with disabilities on Medicare who have high cost medications by providing significant financial relief. It is a major step forward, and I've seen firsthand how those high costs can impact people's lives. Some seniors don't even take their medications because they cost too much money. There's also a new Medicare prescription payment plan that will allow you to spread the out-of-pocket drug costs throughout the year. This makes budgeting much easier for those on fixed incomes. So there was a lot of talk about premiums soaring because of the Inflation Reduction Act and the cap of $2,000. Insurance companies aren't stupid. They figured out how to reconstruct so that it still does keep your premiums at actually, as reported by Fierce Healthcare, lower premium than has been from 2024. In addition, Medicare has introduced a Medicare Part D premium stabilization demonstration. So this program was just announced. It began this year in 2024. It aims to make premiums more predictable and reduce the sudden increases on the Medicare Advantage or Part D premiums. Over 99% of Part D plans are participating, ensuring that most people will benefit from these cost stabilizations. I know from experience that sudden premium jumps can cause a lot of anxiety for Medicare beneficiaries. So this program is another great step towards providing stability in your healthcare costs for 2025. So how do you decide which plan is right for you? If you want freedom of choice, nationwide access to doctors, and predictable out-of-pocket costs, then you want Original Medicare with a Medigap plan, if that's affordable to you. And that also would be with a standalone Part D plan. That might be your best bet. But if you do prefer a lower monthly premium with some added benefits, and you don't mind working within a network, then Medicare Advantage may be an okay option for you. Maybe the best option for you. At the end of the day, it's about finding the coverage that meets your healthcare needs and your specific financial situation. It's not what your neighbor down the street has. It's not what your sister has. It's not even sometimes what your husband or wife have. Each person on Medicare's situation is unique to you. So we're a family-owned business. And when you call us, you will speak directly either with me, with Steve, or with one of our adult children. We've helped thousands of Medicare beneficiaries find the right Medicare plan for their needs. And we're here to help you too. So as we head into the 2025 annual enrollment period, now is the perfect time to review your plan options. I have a prior video where you can learn how to create a Medicare.gov account. And starting October 1st, you will be able to see the new Part D plans inside that account on Medicare.gov. So give us a call or schedule an appointment. You'll find the links in the description of this video to make sure you're on the best plan for your health and your budget for 2025. And also, please don't forget to subscribe to Preferred Medicare for more Medicare updates for 2025. Until then, and as always, I'll see you next time, and please be well.